Brain injury is not an uncommon injury. We all kind of know this. Even folks who have a concussion, there's 20% that go on to have persisting symptoms. And so this is a lot of people every year that are added to living with a brain injury, and folks can live for decades afterwards. So this is a growing number. It's a public health crisis. So when people have a brain injury, they receive some sort of acute care, and then they go on and hopefully they would get rehabilitation, they would get access to good quality primary care, they would get access to supports and services, and they would really get back to living their life. We generally do acute care quite well. I'm not going to say perfectly, but generally we do it quite well. But all those other things, it's a little bit of hit and miss. It kind of depends on where you live. It kind of depends on your personal resources. It kind of depends on a lot of stuff. And so enter into Neurotrauma Care Pathways initiative and brain changes. And this is where we're going to try and affect some change at this stage of the game. People feel unprepared to continue their recovery in the community. Family members, if people have family members, are thrust into needing to know everything. They have to become the experts. This is a 24-hour job. If people are lucky enough to find a healthcare provider, a lot of people are unprepared to work with people who have a brain injury. They're not knowledgeable. So now the person with the brain injury and their family member have to be in the position of teaching the healthcare provider. And sometimes healthcare providers don't want to be taught anything. So that's another challenge. And so you're really kind of left with who should be following them in the community, who do they go to for help, and what is then even available to them. People feel unprepared, confused, stressed, frustrated. If we were chronically in this state, we would not be our best selves. And so we're putting folks who should be focusing on optimizing their recovery in a state where they're not going to be their best self. So the system isn't really helping. So this is where Neurotrauma Care Pathways come in. And I'm from Ontario, but this pathway is not exclusive to Ontario. And it is grounded in 3 different kinds of evidence: research evidence, clinical evidence, and lived experience evidence. We got together with key partners from across the province and we said, where are the gaps in care and how can we solve them? And we built this care pathway. And our focus was on making sure that the pathway could be equitably implemented to provide everybody with key essential building blocks of care that they needed. So this isn't an earth-shattering diagram if you think about the care continuum at all. But what makes this interesting is we've got double-headed arrows. That's really important to understand. People don't go on a linear path of healing. You have to consider environmental and personal factors all the way through the continuum. People are individuals, and that's what makes them cool, but it also means you can't have a one-size-fits-all solution. And you also need team-based primary care engaged from the start. So really, what makes this pathway so special? All of these essential building blocks of care are from clinical practice guidelines. You can go to braininjuryguidelines.org and you can get access to guidelines, living clinical practice guidelines for moderate to severe brain injury, adult concussion, and pediatric concussion. The letters here, those are the gaps, and the idea is that if you implement this care pathway, there won't be gaps anymore. So what makes this sort of different than a lot of clinical practice care pathways is we include things like, patient, caregiver, healthcare provider, ongoing education to understand best practices, what's going on and what should be going on. Communication is important. Support for family and friends. They're going to become so important in a person's recovery, and many acute care facilities and rehab facilities don't even treat them like they exist. The other thing that makes the pathway important is so we write in that these are essential building blocks of care, not a choice. They must be there. Community follow-up needs to be planned for and considered right from acute care, not as an afterthought 24 hours before discharge, right? Peer support is super crucial. People need to not feel alone. And re-access planning and coordination. This is a quote that I really like. The best way to predict the future is to create it. And I think a lot of us in this room are of this same mindset. care pathway implementation. That's really important. Healthcare providers who are informed about best practices, so those are living clinical practice guidelines. And then in terms of people with lived experience, Dr. Galati and I are going to be doing a team-based primary care implementation in Toronto. And the point of this is its extension to current evidence. It fits into the pathway. It's publicly funded healthcare, so equity is not the issue. We're building a framework that involves the 6 lifestyle pillars, uh, informed healthcare providers, peer support. There's a lot of stuff that Brain Changes does with peer support, as well as brain injury associations. The Neurotrauma Care Pathways website. There's braininjuryguidelines.org, and there's also the Brain Changes website.